Hello, everybody. I think good morning to those on the West Coast, afternoon for those of us in the middle and on the East. So we're just getting people in. It's right at the top of the hour here. Thanks so much for joining. I think we had 60, 70 registrants today. So I think we're at about half the capacity. We'll get started in just a moment. So for those of you who I don't know, I'm Andy Dwyer with the University of Colorado Cancer Center School of Public Health. We're going to be talking about sustainability approaches for patient navigation with work we've done in Colorado and with our national colleagues and with our team at WashU who are joining us today. We will just take a moment for some technical updates. I think at the time, Elsa, we wanted people to go ahead and put in your name, first name, last name, where you're attending from in terms of an organization, society, personally, and what part of the country you're from. So state, city, that would be great. So if you can go ahead and use the chat feature. And so Erin, Elsa, anything related to chat to the tech side before we jump into our programming today?
Hi, everyone. You can message me, Erin Martinez, if you need any tech support help during our presentation today. You can also feel free to put any questions in the chat. So thank you. As people are starting to put in their intros, please do introduce yourself because we'd love to hear about where everyone is from. We ask that you stay on mute during the presentation, and we'll have a Q&A portion where we'll invite you to unmute if you would like, and put on your video. But I know some may be eating lunch if it's your lunchtime, so please sit back and enjoy that. And we look forward to this presentation. Thanks for being here.
All right, awesome. And a huge thanks to the Patient Navigator Training Collaborative, Erin, for all of her work. And I know today she's helping with the support of the webinar. But PNTC has been an amazing partner and really helping continue the sustainability work as well. So one of the quick updates I wanted to let you all know, I think it is actually Erin, Elsa, in January 27th from 12 to 1. We are going to be doing some further discussion about payment mechanisms. What are some additional sustainability approaches, and what does the landscape look like in Colorado and nationally? We're doing some of this work through our cancer control work through the colorectal cancer program with funding from CDC and our state health department. So we'll go ahead and also provide information about that opportunity coming forward. But today we are going to be spending our time building off our first session that really talked about sustainability approaches with our partners Karen and Kim from WashU, who are going to kick us off today to talk about a framework for sustainability, really the work that they've done, and then how we've adapted that work for cancer prevention navigation. We set up that framework last time. And today we're going to be spending some time to really talk about what are some of the results and outcomes for the implementation of that work. So I'm super stoked to see that we have many of our partners in Colorado who have actually been part of our teams for that implementation, as well as looking at some of our state and national partners who are joining in, several who've had questions about the framework and how we've been integrating this work moving forward. So with that, I'm going to kick it to Elsa to see if I missed anything. But then after that, I think we will have Kim and Karen from WashU kick us off. So Elsa, anything else we want to share before we get going today?
No, thanks all for being here today. Really excited to continue the conversation. Erin has just put the registration link for that January 27th webinar to continue the conversation. So we hope you'll join us for that as well.
Okay, great. So Kim, Karen, we're going to kick it over to you ladies. And again, a huge thanks for being our mentors and guide in this process. We really couldn't have done it without you. So I'll turn it over to the WashU team.
All right, thanks so much, Andy. And thank you everyone for having us back today. So Karen Bacon and we work together on the sustainability projects in the Center for Public Health System Science at Washington University in St. Louis. And we work with public health, social service, and clinical care programs to help them understand, assess, and plan to build sustainability capacity. We're really excited to be back today. And Like Andy said, we're planning to build on what we talked about last month and share more about the process of planning for sustainability. So I will start with a brief refresher from the last session. So since about 2010, our team at CPHSS developed, refined, and now disseminates the Program Sustainability Assessment Tool, or we call it the PSAT for short. It's designed to measure program capacity for sustainability. So recognizing that sustainability is a major challenge for all kinds of programs, we wanted to create a tool that staff, managers, funders, and evaluators can use to measure their program's sustainability. To develop that tool, we conducted comprehensive literature review, used expert-informed concept mapping, and obtained expert input from researchers, funders, and state and local program managers. That work led us to define sustainability capacity as the ability to maintain programming and its benefits over time. So the framework is sort of to help demystify sustainability by identifying 8 organizational and contextual domains that can help build capacity for maintaining a program. So the programs can be proactive about building sustainability by focusing on strengthening the domains. So the domains in this framework are environmental support, funding stability, partnerships, organizational capacity, program evaluation, program adaptation, communications, and strategic planning. The PSAT can be used by programs in a variety of levels and settings to better understand and plan for their sustainability. But we did receive feedback about the PSAT that there was actually a need for a more clinical specific tool. So we developed a new sustainability framework and assessment tool that was focused on the specific challenges of sustaining evidence-based practices in clinical settings. The development process was similar to that of the PSAT. Through a literature review, concept mapping, and expert input, we came to define clinical sustainability capacity as the ability of an organization to maintain structured clinical care practices over time and to evolve and adapt these practices in response to new information. The domains in this framework are engaged staff and leadership, engaged stakeholders, organizational readiness, workflow integration, implementation and training, monitoring and evaluation, and outcomes and effectiveness. So for more information about these, you can visit our website, sustaintool.org. People can visit, take an assessment online, receive immediate results, and also access resources on sustainability planning. So each of those assessments is quick and easy. They have 5 questions per domain, and they take about 10 minutes to complete. If you do take the assessment on the website, it generates a report that shows your group's results, giving the average and range of each domain and the average overall sustainability score for your program. So both of those tools have been shown to be reliable and valid. They can also help inform a program or practice's sustainability planning. Now, the planning process that our center uses when working with groups that are wanting to build their sustainability capacity is the same for the PSAT or the CSAT. We typically take them through a 3-step process. The first step is to build your understanding of the factors that impact sustainability by familiarizing yourself with the frameworks and the domains. The second step is to assess your program's sustainability capacity by completing one of the sustainability assessment tools. And then the final step is to use the assessment results to inform a sustainability action plan that'll be focused on increasing capacity for sustainability in a chosen domain. We're not going to walk through the entire action planning process today. And your approach may not look just like ours, but hopefully some of the takeaways that we'll share might be useful for your own efforts. So one important thing that we want you to know is that when you're thinking about an actionable plan to build sustainability capacity, It's helpful to think about which domains you have the most control over improving. All the domains in the framework are important, but some are easier than others for a program to address, especially when they're first beginning to work on improving their sustainability capacities. So we typically advise programs not to necessarily choose the lowest scoring domains, but to really think about what domains are the most important to your program and the most feasible to actually make a change in. We also like to emphasize how sustainability is about getting beyond focusing on funding. Funding is important, but we really want you to think about the procedures that you've put in place to strengthen your program's infrastructure so that you're prepared to deal with challenges that come your way. We generally recommend choosing one domain to focus a plan on. Lots of the groups that we work with are enthusiastic and excited and want to work on multiple domains. But it's important to note that all the domains are interconnected. And that means that working to improve in one domain should have a spillover effect and improve in other domains as well. So, for example, if you're working on communications and you're sharing about how your program is impacting the community, that might improve your environmental support because people are learning about all the great things that you're doing to improve access to care and health outcomes. And now they want to support your efforts, which could impact your funding. So there's all kinds of connections like this. Each program has to determine which domains to focus their efforts on to get the most impact for their program because they're all different. Each program has different needs and a different capacity for bringing about change. So when we work with groups, before we even pick a domain to focus a plan on, we ask them to identify their team, define their program elements, and review their sustainability results as a team. So we recommend sustainability planning for your team to include program staff, but also stakeholders to incorporate multiple perspectives. However, the right team will depend on the program. It's most important to include individuals who can and will actually do the work to implement the plan. And it's also important to identify someone who can be the holder of the plan. So the person that's going to drive the process. We also ask a team to define their program's mission or focus before starting on the plan, because having a clear idea of your program's future and purpose can really help unite your group moving forward with action planning. And then reviewing those sustainability results as a team has also been really important for creating a plan, as this can spark up a discussion that informs planning, such as how to leverage your strengths and existing resources to address any challenges that are to your program's sustainability. It's important to note here that low scores don't mean that a program is unsustainable, and high scores don't guarantee sustainability. These scores are a subjective measure of your program's capacity across the 8 domains, and they're meant to get you thinking and talking. Now, when you are ready to develop a plan, there's several key components that we recommend our groups incorporate. When we're working with groups, we help them pick a domain from the framework to focus on, and that focus will then guide the development of a SMART objective. I'm sure you're all familiar with this concept of creating SMART objectives, something that is specific, measurable, attainable, relevant, and time specific. So your SMART objective can guide your plan development and make the plan actionable. You'll break it down further into steps that are specific actions that you're going to take to reach that objective. And for each step, we recommend including who is responsible for seeing that the work gets done, any non-financial resources that might be needed for that step, how you will know when you've succeeded and you're ready to move on to the next step, and then a due date. This is a snapshot of a sample plan that our team developed. I'm just sharing it to give an example of how a completed plan could look. Here, just want you to note the level of detail. So each step has bullets or sub-steps. The plan should be written so that anyone can pick it up, understand it, see how much is complete, and where they can start working. And we do have more action planning samples and different templates on our website, since we do recognize that this is not the only approach to developing a plan. But once we get through that 3-step process, we hope that you will have a concrete plan that you can really put into action. So those next steps are important as well, monitoring your progress and reassessing, because you may need to make changes to your plan throughout its implementation. So we recommend reassessing your sustainability capacity about once a year or on a timeline that works for you. When we work with programs to complete that 3-step process, we invite them to complete a reassessment a year later. We found that this helps programs understand their progress, respond to program or environmental changes, and it also provides another opportunity to reflect on program strengths and opportunities for improvement. So some good news we've found is that being proactive about sustainability can have positive outcomes. Since we encourage programs to reassess their sustainability capacity, we do have some data showing improvement following the action planning process. But to us, what's more important than those scores is the real world application. So this is a quote from a state program that we worked with to complete that action planning process. And the program manager said, as a direct result of the sustainability process, we were able to identify gaps and opportunities for collaboration in order to streamline work and advance program efforts across all organizations. Okay, so as we start to wrap up here a little bit, I'm going to review some key takeaways from our experiences working with public health, social service, and clinical care programs to develop and implement sustainability plans. So again, we encourage choosing one domain where you feel you can actually make a difference. We found this helps programs meet their sustainability plan goals, but also building capacity in one domain can lead to gains in other domains as well. Of course, teamwork is also important. Involving stakeholders from the beginning and throughout can streamline the effort and resources, but that also requires communication. You need to think about what communication channels work best for your team and how you might maintain consistent contact. So this can also help with accountability. It might be helpful to plan regular meetings or check-ins on your progress. And some programs have found it useful to align their sustainability plan with other program plans or activities. So for example, some programs coordinate sustainability planning with strategic planning to create complementary plans that sort of work together. And it's also important to be realistic about your available resources and what you're trying to accomplish. You know, reaching each of those steps and seeing tangible progress can really help momentum, help keep it going. But it's also important to note that everything might not always go according to plan. Enter COVID. But that's why it's essential to monitor your progress and revise the plan in response to any environmental changes, staff changes, funding changes. You know, keeping your plan up to date is essential in building sustainability capacity. We also recommend reassessing your program's capacity about once a year or on a timeline that makes sense for you to understand program progress and changes. You know, as Karen and I reflected on our experiences so far working with programs and practices, we had a couple of lessons learned. We were thinking that the sustainability frameworks were designed for broad application, and they seem to work well in many different settings, but that doesn't mean that they can't be tailored or changed for a very specific group. Also, all groups are different, but there are some similar challenges that exist across groups. We have found that how engaged the group is in the process of sustainability planning really impacts what they get out of it. And then finally, the importance of working together. So you have to have good communication with the program lead as well as the team lead to ensure that everyone sees the benefit of the time and energy that they're devoting to planning for sustainability. Okay, this is my contact information, but I'm gonna go ahead and hand things back over to Elsa and Andy so that they can share about how CCSP used the PNSAT assessment and their sustainability planning process.
Great. So thank you so much, Kim, for go ahead and laying that groundwork, because I think today, as we set that up and building off your work, we're really going to be able to share the implementation strategy and what some of our results have been now that we're about 2.5, 3 years in. So we're super excited about that. Elsa's going to go ahead and share the presentation today. And I just want to commend Elsa Weltzine. When she started with me in the program about 3 years ago, this was one of the projects we were just starting, and she had inherited partly, but she has really grown and helped make this work very much a part of her own expertise in her area. So I'm excited that we're going to get to showcase that today. And huge thanks to all of our partners, Kim, Karen, who've helped build this, but also tremendous work so far. So we'll go ahead and get started. I'll go to the next slide really quickly, where we are going to talk about that application. So just as a reminder, our statewide program, we are a statewide program that's really dedicated since actually back down to 2007 timeframe, how time is flying. We really went ahead and looked at a statewide approach for cancer prevention and control strategies, building off of much of the work with our breast and cervical partners, but really thinking about how do we devote resources for prevention control of colorectal cancer screening. We were able to really integrate navigation as a key part of that work, which we've continued on in our program throughout the duration. So we did have some money for direct services and results in terms of paying for cancer screening treatment and the navigation component. With the ACA expansion around 2014-15, the focus of our program has really been about navigation. But I would have to say that as much as paying for direct services, the treatment barrier reduction has been a huge part of what our program did focus on. We really did find that the navigation approaches for barrier reduction and access were equally a part of the ingredients for getting people screened. So currently our program is funded working with our safety net clinics all throughout Colorado. We provide technical support, the implementation of really thinking about endoscopic screening, but we've also been able to grow our statewide navigation approach and thinking about capacity building also into lung cancer screening, family history and genetic screening work, and also even under that domain of colorectal screening, really thinking about using the number of modalities that are actually coming on the market in terms of blood-based screening and building capacity in that sense as well. So we're excited to be one of the partners in Colorado for navigation support, leadership. Several of you are on the phone today and want to say thanks for all of that work. But we really use this infrastructure and this network to really think about how do we sustain navigation moving forward as one of the largest cancer prevention screening programs in the country. Next slide. So just as a reminder, we did adapt what Karen and Kim have shown in terms of that adaptation of the PSAT, CSAT, because we did have really an amalgamation of part of our approach was really a public health intervention that also had clinical approaches as well. So we did take that opportunity to adapt, working with the WashU team to really think about our 8 domains. And just as a quick reminder, we have coined this the PNSAT, and then of course, citing all of the great work that WashU has done, but really thinking critically about what were those domains that we needed to really measure to make sure that we're really thinking about sustainability in a broader sense for navigation within a prevention and cancer control type framework. So each one of the areas has specific statements, 1 to 5 guiding questions that are going to help, and we'll be going through those results today and what came up for our partners. Completed by ultimately 3 to 7 individuals in that system. I think Kim talked about that it's great to have a really wide dynamic and mix of folks who are really thinking in that specific entity about sustainability and thinking about selection of priority and domains using much of that planning and sustainability framework that Kim and Karen have talked about as well. So, you know, our areas that we really focused and Elsa's going to be reporting upon are really thinking about that engaged staff and leadership, the organizational context capacity, funding stability, engaged community, communication planning and implementation, workflow integration, monitoring and evaluation, and outcomes and effectiveness. So again, I think between the CSAT and PSAT, we really have found something that works well in terms of really thinking about navigation, blending that community as well as clinical context within our work. Next slide. So I'm going to pass it over to Elsa, who's then going to talk a little bit about the number of clinics we engaged, ultimately what we found from the scores, where that led us, and where we're going in terms of this strategy for looking at sustainability for navigation within Colorado and hopefully driving some of the conversations nationally. So Elsa, I'll turn it over to you.
Andy. So for that first step of the sustainability planning process, we had 17 total clinic systems who had their team, their sustainability team, each take the assessment from their own perspectives of the work of navigation for preventive cancer screening and thinking about that capacity in each one of those domains. So on this table, you can see the average PNSAT scores for each clinic team that completed the assessment prior to developing their sustainability plan. And I'll note that those lowest two scores for each clinic system is marked in red. So you can see that overall clinic systems indicated many strengths to support sustainability capacity. And many of those strengths were seen in engaged staff and leadership, organizational context and capacity, and engaged community. And for the 17 clinic systems, their overall average scores ranged from 4 to 6.3 out of that 7-point scale. So all of them with an average score on the higher end of the scale. And in those domains with the highest scores, clinics identified many strengths, including strong champions for the program, that their staff and leadership see the value of patient navigation, and also that they have buy-in from the patient community and specialty care practices that they partner with for referrals and colonoscopy services. And so on the other end, the domains with the lower scores on average were funding stability, as we expected, as well as monitoring and evaluation, which in part was due to the volume and extension of sustainability and evaluation reporting requirements for the program, and lack of compatibility at times for the data tracking tools with their EHR and EMR systems. And so communication, planning, and implementation was also on the lower end of sustainability scores, with clinics seeing a need for increased training and communication among roles and departments. So in summary, from the scores, we can see that there are many strengths in place among our clinic systems that can help support sustainability capacity, and that personnel is one of those really important key aspects. So we were very pleased to see that people felt that those were strengths, that there are those champions and that they are continuing over the many years of the program. And for the lower end of the spectrum, those lower scores being funding stability, monitoring and evaluation, and communication planning and implementation. So you may expect that clinics would like to focus on their sustainability plans on those domains with the lowest scores. However, we'll show that that might not have always been the case based on what clinics could target at this time. So this next view of the table shows, in addition to those scores for each clinic system, the domains that they targeted for change in their sustainability action plans, and those are highlighted in green. And so based on the recommendations and mentorship we got from the Washington University team, we recommended that clinics pick 1 to 2 domains that they felt they could best target for change. And Many clinics did end up choosing 2 domains that they felt were closely related towards what their goal would be in this medium to short term of action. So the domains that were selected for sustainability plans most often were workflow integration and communication planning and implementation. Many domains had similar overall average scores, and clinics felt that workflow integration, communication planning and implementation, as well as other domains that were selected, had equal priority to funding stability and monitoring and evaluation, or whatever their low scores were. And so that it was a priority at this time to strengthen and improve efficiency in those domains to improve the overall success and sustainability of the navigator role. So for example, clinics expressed that ensuring their workflows accurately and effectively captured the navigator role was important, as well as making sure there was up-to-date training in place for the navigation and clinical teams on both the information about preventive cancer screening, colorectal cancer screening, as well as the role of navigator and how that can help the clinical team work at the top of their licensure. So with having those domains selected, even if they weren't the lowest scores, clinics felt it would help establish that necessary foundation to ensure the navigator role was well integrated into the clinical processes, and that foundation was in place to sustain beyond the length of the grant. So even though average scores between many domains were similar, and some clinics did find that they could target funding stability and monitoring and evaluation, many other domains were of equal or higher priority for a 6-month to 1-year period, and workflow integration and communication planning and implementation were most frequently addressed in sustainability plans. So taking those PNSAT results and utilizing those to start to think about a sustainability goal and action plan resulted in some lessons learned from across those 17 clinic systems going through the process. The PNSAT was really useful for sparking those initial discussions of what were those strengths and areas for improvement in navigation and preventive cancer screening. However, it was important to look beyond only the scores. They did help ignite and provide a big picture of some of those strengths and challenges, but it was important to look deeper than just the numbers to understand the differences in perspectives, priorities, and feasibility to address that led to the scores as they were an average of each team member's perspective. And those guiding questions that we integrated into our PNSAT helped provide additional detail and context. So that included specific information about who were those champions and what were important details to note about how processes were working, what had changed in them, what policies were in place, and what were current strategies and barriers that were underway or had been implemented in the past. And so, as Kim and Karen noted, to move the needle in overall sustainability capacity, it was important to narrow down to 1 to 2 domains that really had opportunity for improvement and were realistically feasible to target for change within about a 1-year period for that initial time for sustainability implementation, with the opportunity to continue on beyond, as this is an iterative process. So our sustainability plan template looked very similar and was adapted from the one from WashU. We leaned on their guidance for this, as it was a helpful tool that had already been implemented in the field. And so we did encourage clinics to capture all elements of their sustainability plan in the template. And the template also provided space to outline the specific sources of funding, resources needed, and what would be those specific responsibilities of teams, and what information and guidance was needed from partners as well to achieve their goal. So now I'm going to turn it back over to Andy, who will be sharing a couple of case examples from our clinic system.
Great, thanks, Elsa. And I do think Gabriel had a question, which is how were we defining funding sustainability and what were those questions? So I think we could probably bring up some of those questions to say under that domain, what were some of the specific questions, just to give a sense of some of the flavor. And again, if you guys have any questions, we will get to those probably at the end or try to entertain as much as we can during the presentation. But in terms of really where we were going and looking at some of the approaches, one of our clinic systems really was looking at large clinic systems with integrated specialty care in the Denver area. So really under the umbrella of the integrated care, they really wanted to look at a business model and showing how the navigator that they worked with, who was supported basically in an FTE, with the volume of patients navigated through the program, how ultimately they could sustain that if and when our program likely goes away. So their real domain of focus was sustainability and really understanding how to make that case for that navigator's outcome and effectiveness. Really the team who really helped play a role in pulling together their plan was the GI navigator, the operations manager, the GI, who was actually head of the department in support through the finance and the QI team. So I think, as you know, was noted, really that admixture of folks really engaged and thinking of how they were going to make this business case for sustaining this navigator beyond grant funding was going to be key. So they really needed to think about who needed to be involved in making that play and really thinking about sustainability of that approach. So we were really excited that provided this opportunity. And to date, they've been able to collect 6 months of data in terms of the business case, thinking about using that information for presentation into their clinic leadership team. And as noted, you know, COVID has had a bit of an effect and an impact, but they've already collected great data to be able to make that case. And I think they'll be successful in showing ultimately those outcomes. And then the money that will be dedicated to that approach shows great outcomes and effectiveness that will ultimately support the role and the function of that navigator staying in that position. So that is one group who specifically was really looking at kind of that development, the navigation, sustainability, and that funding. But I think they were also really thinking about that outcome and effectiveness. It wasn't just about funding, it really was showing the value. So we'll go to the next slide. Another clinic that we've worked with, and again, these are representative of several different clinic systems, but just to give a sense of what's happening within our program in Northern Colorado, we really wanted to see the navigation component really look at that capacity building in terms of screening rates and overall looking at stool-based screening and the return of fit kits and really looking at that role in that integration. So they really focused on that workflow, communication, planning, and implementation. And I bring this up partly because even though, you know, navigation and funding of navigation is a big part of that sustainability discussion, you know, there's some groups that have already utilized UDS measures that are already looking at reimbursement from per member per month payment, have already decided to use some of their operational funds because they want to see the value. But what they want to see is, even if they're continuing to support this work and have the funding, it's about keeping that funding and showing those sort of outcomes. So this is one group who really wanted to look at that completion rate and thinking about their workflow and updates to make sure that they can maintain that increase and really maintain that stool-based screening in compliance with their colorectal cancer UDS measures. In that team role, they were looking at the care coordination manager, the navigator, the chief quality operation officer, compliance manager, COO, and also their controller. So again, I think really to that point of that admixture, it's not just one discipline type, it's really thinking about if you're moving towards a specific goal, who's going to really help in that sustainability planning. And I think, as Karen and Kim noted, in each one of these examples, there's also a keeper of the process. And that's the person who's been really in touch with Elsa and myself and really keeping this moving. And both of those clinic sites had someone within that team approach that was really playing that role. So their progress today is they've reached their goal by implementing strategies, including redesigning their POP management and tracking system. They're really thinking about that navigator checklist, specifically around Medicaid and underinsured patients. And they're routinely looking at how do they really keep up that supply and how do they build that capacity, and thinking of that workflow and really the steady stream of supplies to really keep that stool-based screening type of approach moving forward. So again, sustainability for 2 different clinic systems can look a little different, variations on a theme, and they can include different partners, but really they had to make it their own. And we're seeing 2 examples of groups who are going the distance to, again, to help really think about maintaining that function and role of navigation moving forward. Next slide. And I'll turn it back to you, Elsa.
Thanks, Andy. So after 6 months to 1 year of when clinic systems developed their sustainability goal and plan and were underway with implementing that, we had them take the PNSAT a second time to reassess what their current capacity was for sustainability and how it might have changed. And also it was important to note that a little while after clinic systems had built that sustainability plan, with some of them starting at slightly different times, COVID entered our world and shook things up a little bit. But we still thought it was important to measure what had changed with capacity and if having that sustainability plan in place had had an impact, even with COVID adding some extra challenges to the mix. So at that point, we had 14 clinic systems who were still engaged in the process and were able to complete the PNSAT. And we were really pleased to see that most clinics, 11 out of 14, were able to increase their overall sustainability capacity score. And so I have the changes in scores for overall on each of the domains noted in parentheses, whether it was a positive increase or it was a decrease in that score. So 11 out of 14 clinic systems were able to either increase that score or maintain it within 0.2% of the previous scores. And 11 clinic systems also saw direct increases in the scores for the domains that they were directly targeting for their sustainability plans. And this demonstrated that many clinics were able to take steps to implement their plans and improve that foundation for sustainability of preventive cancer screening, no matter which area they were focusing on. And it is important to note that that COVID pandemic, of course, probably slowed the pace of progress and might have had an influence for some of those clinic systems that were unable to improve their score. And also I'd like to note that funding stability has remained as that lowest average score overall, but 10 out of 14 clinic systems did increase their score in that domain, even without direct focus for many of those clinic systems. So you can see, if you take a look at this table a little more in depth, that many clinic systems were able to increase scores across several domains from that focus on sustainability capacity and really strengthening on a specific area. And so it demonstrates that many clinic systems have made progress in strengthening the foundation for the sustainability of preventive cancer screening navigation, but there is additional work to be done. And after taking that second round of the PNSAT is a great chance to revisit those conversations in progress made, what might need to be changed for that goal and the steps to achieve that goal if that actual process is working to increase sustainability. So I'm going to turn it back over to Andy to share a little bit more about the current status of the work and where we go from here.
Great. And also when we say 11 of 14, we're thinking there's the clinic system. So in general, the systems with that number, we're probably close to 75 individual clinic sites, I would guess. Is that correct throughout the state?
Yes, that is correct. So the clinic systems we work with range from having just one site as a standalone primary care clinic, with many of those being in rural areas, to up to 25 sites for some of the larger clinics.
Okay, that sounds great. I just want to remind everybody, if you have questions, let us know. We will be pulling up some additional materials to help facilitate some of the questions that have come in, but let us know again in the chat as we're getting ready to wrap this up pretty soon if you have questions for Kim, Karen, Elsa, or myself. But in terms of really think of our status of the work and our continued efforts, we are going to really be thinking about CCSP continuing with this work and the implementation. As also noted, the COVID component has been a little difficult really with that reexamination. People are really busy. So having them sit down and get together as a group to talk about this can be difficult, but at the same time, that's something that we absolutely have to focus on, because I do think that some of our CHWPN roles have been a little more vulnerable to being layoffs, what have you, or repurposing the positions right now in that response. So really thinking that role and value. We're really trying to be proponents of that with many of our partners as well. We're really thinking about that capacity for really thinking not just in colorectal screening, but how we think about cancer prevention in general, and really thinking about integrated approaches to screening. And I think even with some of the work that's come up, part of the mention of our programs with our breast and cervical program and navigation support throughout the different programs is coming up. So I do think that we're seeing in some of the work that unless we really think about integrated approaches to cancer prevention navigation, it might be a little more vulnerable for losing that funding if it's just for one body part, especially for clinic systems, like Elsa said, who might not have a volume of patients to support, just colorectal cancer screening navigation. We're really thinking about that external support and navigation reimbursement, quality metrics, training, and TA resources. We have a number of conversations happening at the state and national level, thinking about how do we use this information to really think about deployment of other strategies to support navigation based on what we've learned. I think at an individual site level, there's information. From a system level, there's information, but we're really trying to think about how do we learn from what we've heard statewide to be able to make some discussion and some inroads with policymakers and others about where we're going and thinking about that navigation support. And I don't think it's all about funding. I do think quality metrics in other areas, even if we sustain that work, is going to be something that's essential. And ultimately for the CCSP sustainability planning work, much like today, we're really interested in disseminating this information as models for people to think about what we're learning. And we're really thinking about continued opportunities. So we're excited that with the National Navigation Roundtable, we will have an article that further showcases part of the work we've discussed today, an impact and thinking about the dissemination and implementation approaches. So hopefully that will be published in spring of 2022 or summer of 2022, and that's something that's coming as well. For those of you who can hear, my dryer likes to speak to all of us, so if you hear that chiming, apologies there. And experiences from CCSP, we really want to look at how we're using this information to help support groups like the National Navigation Roundtable. ACS CAN is really looking about how do we move this work ahead. What we're really thinking from even the National Colorectal Roundtable and others who've helped put some support in thinking about sustainability. And I even know that even with some of our community health worker partners, as well as with our safety net partners, even at the state and national level, utilizing this information, do we think about delivery of cancer prevention and control with navigation in primary care is going to be pivotal as well. So we're really excited about this. I'm really excited again that I think Karen and Kim have played a huge role in helping us think about implementation and how do we tether ourselves to a framework that has strong reliability. And we're really, again, trying to adapt this moving forward. So Elsa, I'm going to have you just share in terms of the reflections about the sustainability process as we close out, and then we'll go ahead and get into some of the responses to our questions.
Thank you. So we're really excited about where we're going from here and how this can continue to be a valuable exercise to really move towards a sustainable navigation role for all of our clinic systems that are utilizing the patient navigator. So as we have reached this point in the process, we've come to a few reflections about what's worked and what's been challenging with the process. And many of these are similar to what the WashU team has found in working with many different programs. So it really is key to include several different perspectives in the sustainability planning team, including leadership, but also that navigator role, managers, QI, and finance, who can really help provide some additional context for areas that some people might not have all of the answers or full understanding of what's really happening for each of those domains, because it is such a wide range of perspective. But sustainability planning can really help move the needle in understanding what is feasible to target for change internally by a program or a clinic system, and then what external support is still needed from some of those partners like CCSP and other groups at the state and national level that are helping to really build that foundation for navigation as an integrated piece in clinic teams. And then COVID, of course, and other disasters or big changes can add extra domains and volatility for sustainability capacity. And so as there's always changing situations, it really is valuable to revisit that capacity at least annually and make adjustments to plans and goals. And it really, by focusing on 1 to 2 domains, we've seen firsthand with our clinic systems that you can see those improvements beyond just the domains of focus that can really lead towards that overall foundation and strengthening for sustainability. So thank you all for the time today. I've linked the resources for our PNSAT website where we have all of the tools, as well as more information about CCSP and the Paying for Colorectal Cancer Screening Navigation Toolkit that really was a foundation for going through this process, and our contact information. So thank you.
Great. Thanks, Elsa. And I know Elsa's going to pull up some of the questions and some of the things that have come up for a couple of questions. I'm going to go ahead and just, we can open up the lines. So if you have any specific thoughts or questions, you can come off mute, or if you want to go ahead and put anything in the chat, that would be welcome while we have about 7-8 minutes while Elsa is bringing up those materials. Kim, Karen, I guess while we're having people either reflect or think or wait here, I guess in terms of what CCSP has showcased, you know, I know that Elsa had talked a little bit about some of those domains and what you've seen with other programs, but I guess in terms of seeing these results and the implementation, is there anything unusual about what we've seen through this navigation approach, or anything that's very similar that really struck you all?
So I would say I was not surprised to see, you know, when there was growth in one domain, that you also saw it in more than one. I would say what I was surprised to see was how much growth there was even during COVID. And I think that is pretty amazing for all of the centers that have been really working hard on this. I think they should be proud of that.
Great. And I know several of you are on the phone today, so whoop whoop to you. Karen, anything else?
I would agree with what Kim said. Yeah, it was just amazing to be able to see them have that growth. I thought one thing that was interesting to me was when you showed the chart of the scores in the different domains, just, you know, when you look at them as individually and then just kind of not comparing them to each other, but just sort of looking at them as a whole, you know, it was really interesting to see that it's like, there's challenges and there's growth for capacity in every single domain. It's not that there's one domain that's like universal that everybody really has figured out. When you looked at those lowest scores, there wasn't a single domain that didn't have, you know, one score being picked up in there. So I always think that's kind of interesting to see, because a lot of times Kim and I get asked about, well, what's the one that everybody's really good at, or what's the domain that everybody really struggles at? And I think that chart that you showed really shows that there isn't just one.
Mm-hmm. Definitely. That sounds great. Thank you, ladies, for that. And then Erin, I just want to ask, you know, Elsa's going to run through these questions quick. Erin, were there any other questions that came up to you specific?
No, I didn't see any other ones in the chat.
Okay, great.
So if anyone wants to pop it in the chat, or yeah, we'd love to hear any questions about how this could work for you.
Great. Elsa, do you want to go ahead and move through Gabriel's question? I think that was a really good question.
Yes. So Gabriel's question was, how do participants define funding stability? So whether this could be for the next few years or long-term. And so our funding stability domain really integrated many of the particular questions from the PSAT developed by WashU with some small adaptations made. And so what we were having clinics look at was whether that practice of patient navigation for preventive cancer screening with focus on CCSP, but not limited to, had established a consistent financial base. And so those main indicators that clinics rated on a 1 to 7 scale was whether the practice existed in a supportive state economic climate at this time, whether the practice has policies in place to help ensure sustained funding, whether there's a variety of funding sources, as well as a combination of stable and flexible funding, such as grants and internal support, and then what the practice has sustained funding and a long-term financial plan. With some additional guiding questions we had them add, which is what is currently going on, and some of those nuanced details and what they think might help sustain the practice and fund it after our grant funding ends, and then what they might have done already to help obtain extra funding to support patient navigation. So with that, we were looking at that current situation, which is why it's important to review on an annual basis, but also having the opportunity in the discussion and the guiding questions to show what has changed over time, what's been done in the past, and what they're focusing on going forward.
Definitely. Okie dokie. So I just want to tell everybody again, I think we're still in the process. We're really hoping that we can utilize this information to, of course, not just in the peer review literature publish, which is no small feat, as we all know, but we're going to continue to actually provide some white papers, I think, to people who are making decisions in Colorado about funding for additional support in this area and thinking about mechanisms. This will be critical information. But I also know that it's really thinking about frameworks. It's really helping us think about where we're going in terms of the overall direction within the country, and hopefully really thinking about really sustaining navigation and a lot of connections also to the CHW world as well. But Kim and Karen, I think in terms of the name of the game of really thinking about this from a design and framework, just want to say thank you to WashU. And ladies, I know the question always comes that if folks are really thinking about moving in a direction or adapting a tool, you know, what advice you would give. I would say on behalf of CCSP, we reference and cite WashU. Our materials are available in the spirit of sharing. I think if there's ways to collaborate and share information to see where we're going, that's always definitely welcome. But Kim and Karen, I'll give you the last word about just sharing and you know, providing your information as a resource moving ahead and what advice you give to folks.
Karen, do you want me to jump in? All right. Yeah, well, I would say, Andy, thanks. It's been really amazing getting the opportunity to work with you all and you know, see the tool that you've developed and shared. And it is true. You know, we hope that we make our tools available for free. We hope that people and we hope that people adapt them if that's what they need. But we also hope that they share those adapted tools. And so I think that's really, really great. But we've enjoyed this partnership and love, like hearing how your, you know, different organizations and clinic systems are doing and all the great work that's been happening. It's been a pleasure for us to be part of this process with you as well. But for anyone else who's thinking about this, you know, sustaintool.org is our website. We could reach me or Karen. You have access to our tools, our resources. And if there's any questions or if you're looking for any more information or any kind of specifics, please feel free to reach out to us. We're always happy to help.
Great. Thank you, everyone. Erin, anything else? I know Elsa has popped in our evaluation, but we're going to be closing today. Erin, Elsa, we will be saving today's presentation on the CCSP website, I believe. Anything else, ladies, before we close today?
Thank you all so much for
Thank you.
taking the time.
Great. Have a good day, everybody. Thank you for joining.
Okay.
And hope to see you maybe on the 27th as we continue this discussion, even in broader context around sustainability within Colorado and the nation. So thank you so much. Have a great day, all.